Mr. President, I come to the floor today, as I have over the past year and a half, as a physician who's practiced medicine in Wyoming for about a quarter of a century, get home every weekend, visit with my former patients, my former colleagues, and as I talk to people around the state of Wyoming about the health care law, the newly passed health care law, their concerns are those that we've heard from around the country and certainly here on the Senate floor. And that's why I keep coming back to the Senate floor with a doctor's second opinion about the health care law. Because what we know patients would like in terms of health care is that they get the care they need from a doctor that they want at a cost that they can afford. And for many, many people across this country, the cost that they can afford is a major, major issue, which is why I think so many people were happy to hear the President in his initial talk about what he was proposing for health care in this country. He said we need to get the cost of health care down. And he said if his bill were to pass and become law, the cost of care, he said, would drop about $2,500 per family across the United States. That's what people were looking forward to. And in so many ways, the President overpromised and underdelivered. Because what people have seen is the cost of their care has continued to go up as a result of the President's health care law. The states around the country are now looking at ways to deal with this health care law. Many states have set up committees to deal with that based on their state legislatures, and we have done the same thing in my home state of Wyoming. In Wyoming, we've asked for a study to be done to take a look at what the impacts of the President's health care law would be on health care and the cost of care in our state. And a report was authored by a Massachusetts group called Gorman Actuarial. It examined how the health reform law passed last year by Congress is going to affect the state of Wyoming specifically. This information is being used in Wyoming by our Health Benefits Exchange Steering Committee. That's the committee which is reviewing various options for a state-run health exchange. And that's what people are looking at. What is the best thing to do for our state? Well, as they've come upon this work effort, what they are telling us is about the individual market for insurance. People that end up buying insurance individually, having to go out, don't get it necessarily through work, in different ways, but they have to buy the insurance on the individual market. This report says that in Wyoming, as a result of the health care law, the current individual market enrollees will see average premiums increase by 30 to 40% based on the components of the law. Now, some supporters of the law say, well, they're going to get more insurance than they would otherwise. And that is true because they are going to get a government-mandated amount of insurance, which may be a lot more insurance that they want or that they need, which is one of the fundamental problems of this health care law, government-mandated levels of insurance. Many people in Wyoming feel they don't want that level of care, which is why I believe individuals should be able to opt out of this provision of the health care law. States ought to be able to opt out. States, individuals ought to be able to receive a waiver, but right now, that is not happening. So what we're seeing in Wyoming is a significant increase in the cost, not the decrease that the President promised, but an increase in the cost of health insurance beyond what it would have gone up had there not been a health care law at all. And yet I talk to young people around the state, and I met with a number of young people from my state just the other evening, and they asked about this and how it's going to affect the young. Well, what we see is that their rates are going to go up quite a bit. And a lot has to do with the fact that the lowest amount you can end up charging someone who's young, and then you compare that to someone who is older, the ratio is 3 to 1. So for someone who is not very healthy and older, they will only be paying 3 times what a younger person will be paying based on what passed this House and this Senate, which means that for those younger people, they're going to pay a lot more than they necessarily would based on their own good health, exercise habits, fitness, diet, and in terms of what their real costs ought to be insured. And so I guess it's not a surprise when we saw the election results coming out of the state of Ohio Tuesday a few weeks ago about the specific individual mandate that said everyone has to buy insurance. On that day, on Election Day in Ohio, 66% of the voters said they didn't want this government mandate, a mandate that you must buy government-approved insurance. They don't want that to apply to them. 2/3 of the people of Ohio on Election Day voted against the mandate, which is not unusual to see because we've seen that across the country. We've seen that in Missouri last year on balloting day. We saw it as they do national polls. This health care law is less popular now than it was the day it was signed. People continue to want to be able to get out of underneath the health care law, which is why I continue to come to the Senate floor week after week with a doctor's second opinion as more information becomes available, just as this study in Wyoming has become available. Because the president's promise, if you like what you have, you can keep it, we're finding out that's not true. And the fact that the president promised that health care premiums would drop for families by $2,500 per family is not true. And that's why I continue to believe that this health care law is bad for patients. It's bad for providers, the nurses and the doctors who take care of those patients. And it's bad for the taxpayers of this great country. That's why it is time to repeal and replace this broken health care law. Thank you, Mr. President. I yield the floor.